sure you heard about the term called gynecomastia or man boobs. What is gynecomastia? Kindly follow this video and see it further to understand more. My name is Dr. Desai. I am a board certified cosmetic and plastic surgeon. I am practicing in Mumbai and Pune. I have over 20 years of experience treating gynecomastia and other cosmetic and plastic surgeries. So what is gynecomastia? Gynecomastia means man boobs or female like boobs which come in a man. What does it cause? A lot of social psychological disturbances. When you get this condition at a young age, this normally occurs at puberty. Many men start seeing this, young boys, young men start seeing this at the age of 14 to 16 to 18 years as they're growing up, as they're entering college or entering into puberty and they're finishing their teens, and they're very psychologically disturbed about this. Most of the times, to hide this condition because it looks female like or funny, they will not wear tight clothes, they will not wear t-shirts, they'll wear loose ill-fitting shirts, they will always hunch in order to hide this, or they will not go for swimming, they will not go out in many social functions because of the embarrassment it causes. Hence, this has to be treated early and this has to be operated and finished early if there is. In certain cases, it can also cause pain to the patient, especially on movements or on pressing, and it causes a lot of embarrassment. There is a lot of awareness about gynecomastia, but not correct awareness in most of the cases. Okay, many times gynecomastia means what? It's like a gland which is under the nipple areola and it can have fat all around. If it is only fat, you can reduce it by diet and exercise. But if the gland is there, it will only go surgically. It cannot go by diet exercise. Hence, when they approach their family and friends, they tell them that lose weight, it will go away by itself, and patient keeps struggling for a number of years for no reason, and he does not get the right treatment for it, and he remains in this psychosocial trauma or in this physical trauma for a number of years for no reason. Hence, you need to recognize and treat gynecomastia early. What causes gynecomastia? Most of the time it is genetically predetermined, or you really don't understand why it causes, or there could be hormonal imbalances where there is more of certain hormones in the body as compared to other hormones, rarely because of certain drugs that we take for heart or for acidity. But yes, most of the times you don't understand the cause, it's just genetically predetermined, and maybe there may be minor hormonal disturbances. Can you cure it by any medical problems? No, you cannot. You can prevent further enlargement by stopping any predisposing factors. But once if this occurs, then you have to do a surgical correction. Like I said, there are two components in gynecomastia, fat and the gland. Fat can be reduced by diet and exercise, but the gland has to be surgically operated. Now the cut which is taken around the nipple areola is very tiny, sutured with very thin sutures, cosmetic sutures, and the scars are practically not visible. So we don't need to be worried about scars in the future. If the breasts grow too much, if the gynecomastia grows too much, if there's a lot of loose skin, then you may need other procedures like a chest lift or a body lift in order to cure it, and that may leave scars, but those are extreme cases. We must prevent it to go to these kind of stages. The gynecomastia surgery typically is like a 45 minutes to a 1 hour surgery. You don't need to get admitted. It's a daycare surgery, and you wear a corset post surgery for the skin to drape over the underlying muscles and the tissues properly. Is it safe? It's extremely safe because you're not operating on any deeper organs. The main thing you need to be careful is you remove equally from both sides so that there's no unevenness, and that can only be done by a proper, skillful, experienced, board certified cosmetic and plastic surgeon, and hence choose your surgeon carefully. We perform around 15 to 25 gynecomastia surgeries every month. It is as common as that. They say 2 out of 10 males suffer from it. Not everybody goes in for the surgical option. Most of the times they are scared to undergo surgery or they are thinking about surgery. Would any other method help here, like cryolipolysis, etc.? No. When you have gynecomastia, you have to either remove it by a combination of liposuction and excision or excision alone. But there is no other method which will work here. So please do not try other things. You may only worsen the condition and it may only cause more and more problems later. Is it necessary to treat it early? Yes, like I said, if the at a growing stage when he's getting socially active If a young adult male undergoes this social and psychological trauma, it will not be good for his mental psyche. That is why you must treat it. We normally tend to treat this condition at the age of 18 years so that when he goes into college, or he can be more confident about the kind of clothes he wears, or when he goes out socially in swimming or other social functions. So recognize this treatment and treat it early. That is more important. And yes, it's a very common and a safe surgery. So do not worry, and make sure that you do not listen to all the myths about surrounding gynecomastia surgery. Do like this video, share it amongst your friends and colleagues, and follow our channel to know more about gynecomastia and other cosmetic and plastic surgeries, and clear your myth about a lot of procedures. Okay, or visit our website or call us and book an appointment. Thank you.